you're called to the scene of a house where the man has beat his wife really bad, and when you arrive, there's no one else on scene but the patient.
Okay. So BSI, is the scene safe as police clear me to go in?
Yes.
Okay. So I will come up and I need to determine my mechanism of injury, which was a domestic violence. I'm going to determine one patient, is that correct?
Mm-hmm.
I'm going to call for ALS just to be safe, and I'm going to have Casper hold C-spine at this time, so because I don't know if she was thrown downstairs or anything, so I'll have Casper hold C-spine. My general impression is probably poor to ugly. I'm going to come up and try to get a level of consciousness. Hey, are you okay? Can you hear me? Is there any response? Okay, I'm going to check a painful stimulus. Ma'am, can you hear me? My name's Tony.
No response.
Okay, so no response. My patient is unresponsive. So I'm going to do a quick scan for life threats. Do I see any major life threats?
No.
Okay. I'm going to have Casper open the airway using that jaw thrust. Do I see anything inside the airway? Gurgling. So I'm going to suction, and does that clear the airway?
Yes.
Okay. Now she's unresponsive, so I need to put in an OPA. Does she accept the OPA?
Yes.
Okay. I'm going to do a quick check for breathing.
26.
Okay. Patient's at 26 breaths per minute. So I need to apply, I'm going to have Casper BVM the patient at 15 liters per minute. Is that adequate now?
Yep.
Okay, I'm also going to auscultate the lungs, starting in the lower lung fields and moving my way up. What are my breath sounds?
Clear.
Clear on both sides. Okay, so now I'm going to check circulation. I'm going to take a carotid pulse. What's my pulse?
60.
Okay, so a pulse of 60, that's pretty normal. Skin conditions are warm, pink, and dry. What are they really?
Warm, pink, and dry.
Okay, so they're really warm, pink, and dry. Okay, so she's not really going into shock at this point. Do I see any major bleeding?
No.
Okay, I'm going to cover the blanket or cover the patient with a blanket, and I already have the oxygen on, but I can't lift the legs because I'm assuming spinal at this point. I'm going to do a rapid scan starting at the top of the head. She should be in C-spine. So I'm going to feel the top of the head, looking for blood, and basically doing a blood sweep, checking the back. Feeling the forehead, the nose, opening the eyes, checking for pearl. They pearl?
No.
They're not pearl.
They're
So
not.
indicating a brain injury, feeling the nose, looking in the nose for any drainage. Do I have any drainage?
Yeah.
Okay, so with the non-pearl and the draining out of the nose, good chance that there is a skull fracture. Feeling the zygos, the maxilla, the mandible.
Everything's good.
Everything's good. Looking in the ears and behind the ears.
Yeah, there's
Battle signs, so very good chance of a skull fracture. I'm going to open the mouth, look for any missing teeth or anything.
Everything's there.
Okay. I'm going to check for tracheal deviation, jugular distension, and step-offs.
There are no step-offs, but there is tracheal deviation.
To which side?
The left.
To the left side. Okay. And is there a jugular distension as well?
Yep.
Okay. So noted, decent chance of a tension pneumothorax. I'm going to put on a C-collar. Okay. And then I'm going to quickly look on, or press on the chest, the ribs, and the center. Is everything normal?
There's flail. You notice flail chest.
So on the right side, I'm assuming?
Yep.
Okay, so I'm going to apply a bulky dressing and tape that down. Does that take care of the flail chest?
Yep.
Okay, I'm going to palpate all 4 quadrants. Do I find anything abnormal?
No.
Okay, I'm going to push on the hips, down and in. Anything abnormal?
No.
Okay, sweep the genitals, go down each leg.
On the left leg, there's a mid-shaft femur fracture.
Mid-shaft femur fracture, so that probably would have been noticed in the life threat, but I'll have another Casper pull a little bit of traction, and then we will apply a traction splint to that. Come down and feel both legs. Anything abnormal?
No.
Pulses, are they present? Then she can't pull or push. I'm going to come down both arms. Okay, anything abnormal? I'm going to feel pulses.
Yep, present.
Both present. Okay. So at this point, we have a mid-shaft femur fracture, we have a tension pneumothorax, which we need ALS, which I called for originally, and we have a flail chest on the right side, along with a more than likely brain injury. So this is going to be a load go. She has a GCS of 3, and we are going to get on, or put her on a backboard and load her in the ambulance. I'm going to try to gain a history. Can't get it from the patient. Is there anybody on scene I can get a history from?
Nope.
Okay, so no history. So now we're in the back of the ambulance. I'm going to go through and do my secondary full body scan. This is going to be a very systematic full body feeling everything, checking the head, and you sort of decap BTLS. Is there anything?
Just some bruising.
Just some bruising, okay? Feeling the back of the head, the forehead, the eyebrows, opening the eyes, checking for pearl. They're still not pearl.
Still not pearl.
Okay. Checking for zygos, the nose, looking in the nose.
Same.
Okay. Checking the mouth, anything?
Nope.
In the ears, behind the ears.
Still vital signs.
Okay. Is she still drained from the nose?
Not anymore.
Not anymore. Okay. Well, I would have caught it if it was still drained instead of putting anything up there. I'm going to recheck tracheal deviation, jugular distension. Everything's still there?
Still there.
Okay, so we need to get ALS to do needle decompression, feel the back. Okay?
Still does.
I'm going to press down on the shoulders, in on the ribs, avoiding the injury area, and in the sternum. Anything abnormal?
Nope.
Okay? I'm going to feel all 4 quadrants. Anything abnormal?
Nope.
Okay, down and in on the hips.
Nope.
Okay? Feeling down both legs. Anything?
Nope.
Okay? We already have the traction splint applied to the femur fracture, so going down, skipping the femur fracture, but going down the lower leg, find anything different?
No.
Still pulses?
Still pulses.
Okay. Come up here and come down the arms. Anything abnormal?
Nope.
Feel for pulses?
Present.
Okay. So now I need to take a set of vitals. So I'm going to take a blood pressure. What's my blood pressure?
90/60.
90/60. I'm going to retake my pulse.
60.
Okay, and my skin condition still warm, pink, and dry.
Still warm, pink, and dry.
Okay, and then I'm also going to retake my respirations, and she's being bagged at 12. Is that still standard?
Yep, she's on about 14.
Okay, so she's being bagged at 14, and lung sound's still clear.
Yep.
Okay, so I've done my secondary, I've done my vitals, and now my reassessment. She's a critical patient. I'm going to reassess on the way to the hospital every 5 minutes.